Bones provide support for the body and aid in its movement. The place where two or more bones meet is called a joint. Joints may be immovable, slightly movable, or freely movable. A synovial membrane surrounds movable joints. Inside the membrane, synovial fluid lubricates and nourishes joint tissue, such as cartilage. Articular cartilage is a tough, slippery covering on the ends of the bones, which allows smooth joint movement. Joints give the body flexibility, precision of movement, and help in supporting the body's weight. Arthritis is any disorder that affects joints. It can cause pain and inflammation. Rheumatoid arthritis is the second most common type of arthritis. The joints most commonly affected are in the wrists, hands, knees, ankles, and feet. It typically occurs at the same joint on both sides of the body. It can also affect other organs in the body, such as the eyes, skin, heart, lungs, kidneys, nervous system, and digestive tract. Rheumatoid arthritis is an autoimmune disorder. This means the body attacks itself by mistake. In rheumatoid arthritis, the immune system attacks joint and organ tissues. Here's how it happens. The white blood cells of the immune system move into the joint. They release chemicals called cytokines, which attack the cells of the synovial membrane. These chemicals cause synovial cells to release other destructive substances. They also cause the synovial membrane to grow new blood vessels and form a thickened area called a pannus. Over time, as the pannus grows, it invades and destroys areas of cartilage and bone inside the joint. Inflammation causes fluid buildup in the joint, making the joint swell. Eventually, without treatment, the joint space narrows and ankylosis can occur. Ankylosis is fusion or growing together of bones in the joint. This results in the loss of the ability to move the joint. There is no cure for rheumatoid arthritis. However, doctors commonly prescribe various combinations of the following medications that, when taken together, can reduce inflammation and pain and slow down joint damage. These include non-steroidal anti-inflammatory drugs, or NSAIDs, steroids, and standard disease-modifying anti-rheumatic drugs, or DMARDs. If standard DMARDs aren't working, doctors may prescribe newer drugs called biologics, also known as biologic DMARDs. Physical and occupational therapy, along with low-impact exercise, can increase muscle strength and help keep joints limber. For severe rheumatoid arthritis that has not been helped by other treatments, a doctor may recommend a surgical procedure. For example, a joint replacement procedure, also known as an arthroplasty, may be recommended. For joints that are difficult to replace, joint fusion, also known as arthrodesis, may be recommended. During this procedure, the joint is removed and the bones are fused together with bone graft. Another surgical procedure for severe rheumatoid arthritis is a synovectomy. During this procedure, the synovial membrane surrounding the joint is removed. In some cases, an arthritic joint may need to be replaced with an artificial joint. For more information, talk to a healthcare provider.
Although many of you may not know, I have had juvenile rheumatoid arthritis since I was 3, and it hasn't been easy. It's been a struggle. I've gone through some procedures, I've gone through bad stretches, but that is what I have, and I live to fight with it because I don't have any other options. You either choose to battle with what you have, or you can let it affect you, and you can let it ruin your life. But I did not choose to let it ruin my life. It's been very difficult. There's things that the average person can do that when you have rheumatoid arthritis, when you do that, it's a struggle. Things such as brushing your teeth, typing on the computer, opening up a jar, tying your shoes, getting out of bed. These daily things that give you struggles in your joints. Can't even imagine what it is like when you play sports. My doctors always told me, activity is good for you, but you're not allowed to play contact sports. And for me, hearing that growing up, I'm an athlete, I enjoy playing sports, I didn't like that. So they didn't say it was illegal for me to play sports, but they said playing sports takes a toll on your body. And that's the toll I took because I have a passion for sports. So, over the years, I played my sports and I've had my many injuries, which resulted in 3 surgeries, 25 broken bones, multiple sprains and fractures, and just good stuff like that. And actually, as of right now, my back is deteriorating. My doctors say that if I continue to play sports at the rate that I played them my whole entire life, I will need a back replacement by the age of 30. There's just certain days when getting up isn't something you want to do. It's hard because mentally you're ready. You want to take on the challenge. You want to go about your day and do the things you have to do. But physically, you can't move. It has to be one of the worst feelings ever. But I tell you, the feeling you get when you fight that sickness, when you push yourself to get out of bed and continue on with your day despite the pain you're in, it seems all worthwhile. Me and my doctor fight a lot because me and my doctor have a love-hate relationship because she's always telling me that I can't play sports and I'm always fighting her, telling her I can, but in the end, she always wins. I always go to the doctors at least 3 times a month. I have to take my daily medicine, and the medicine adds up. Yeah, fuck bitches, get money.